Section 5 of Aids to Forensic Medicine and Toxicology. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Linda Ferguson. Aids to Forensic Medicine and Toxicology by W.G. Aitchison, Robertson. Section 5. Chapter 20. Death from Starvation. The post-mortem appearances in death from starvation are as follows. There is marked general emaciation. The skin is dry, shriveled, and covered with a brown, bad-smelling excretion. The muscles soft, atrophied, and free from fat. The liver is small, but the gallbladder is distended with bile. The heart, lungs, and internal organs are shriveled and bloodless. The stomach is sometimes quite healthy. In other cases it may be collapsed, empty, and ulcerated. The intestines are also contracted, empty, and translucent. In the absence of any disease productive of extreme emaciation, example, tuberculosis, stricture of esophagus, diabetes, Addison's disease, such a state of body will furnish a strong presumption of death by starvation. In the case of children, there is not always absolute deprivation of food, but what is supplied is insufficient in quantity or of improper quality. The defense commonly set up is that the child died either of marasmus or of tuberculosis. In cases where it is alleged that a child has been starved and ill-used, one must examine the body for signs of neglect, example, dirtiness of skin and hair, presence of vermin, bruises, or skin eruptions. Compare its weight with a normal child of the same age and sex. If the disproportion be great, and signs of neglect present, then the probability is great, provided there be no actual disease present, that the child has been starved. Chapter 21. Death from lightning and electricity. The signs of death from lightning vary greatly. In some cases there are no signs, in others the body may be most curiously marked. Wounds of various characters, contused, lacerated, and punctured, may be produced. There may be burns, vesications, and ecchymosis. Arborescent markings are not uncommon. The hair may be singed or burnt, and clothing damaged. Rigor mortis is very rapid in its onset and transient. Post-mortem there are no characteristic signs, but the blood may be dark in colour and fluid. The presence or absence of a storm may assist the diagnosis. Injuries by electrical currents of high pressure are not uncommon. Speaking generally, 1,000 to 2,000 volts will kill. In America, where electricity is adopted as the official means of destroying criminals, 1,500 volts is regarded as the lethal dose, but there are many instances of persons having been exposed to higher voltages without bad effects. The alternating current is supposed to be more fatal than the continuous. Much depends on whether the contact is good, perspiring hands or damp clothes. Death has been attributed in these cases to respiratory arrest or sudden cessation of the heart's action. The best treatment is artificial respiration, but the inhalation of nitrite of amyl may prove useful. Rescuers must be careful that they also do not receive a shock. The patient should be handled with India rubber gloves or through a blanket thrown over him. Chapter 22. Death from cold or heat. Cold. The weak, aged, or infants readily succumb to low temperatures. The symptoms are increasing lassitude, drowsiness, coma, with sometimes illusions of sight. Post-mortem, bright red patches are found on the skin surface, and the blood remains fluid for long. Heat. Death may result from syncope, the result of exposure to great heat. Sunstroke. The person loses consciousness and falls down insensible. The body temperature may be 112 degrees Fahrenheit. The pulse is full, and a peculiar pungent odor is given off from the skin. Coma. Convulsions with, rarely, delirium may precede death. Treatment consists in lowering the body temperature by application of cold cloths, stimulants, strychnine, or digitalin hypodermically. End of section 5. Recording by Linda Ferguson.